So today we are going to discuss the cervix. In the previous discussion, we talked about the uterus. Now, this is a cervix, which is just a lower segment of the uterus. So the cervix is part of the uterus. Now, it has some variations from the rest of the uterus that are worth noting. So we said the point where the body of the uterus, that is a body, that is a fundus, meets with the cervix, we call it the isthmus, or the isthmus, if you like, or the neck. So that is isthmus. Then this is a cervix or neck. Then we have two orifices in the cervix. We have an external orifice, which is here. We have an internal orifice that is there. In addition, we have the part of the cervix that is connected to the uterine cavity. This is a uterine cavity. So this part of the cervix, that's a cervical canal, is known as the endocervix. Then we have the part of the cervix that is in the vagina. Remember, vagina has fornices, so there will be fornices here. So we call that as the ectocervix. So ectocervix, endocervix. Now, the endocervix has a mucosa which is lined by simple columnar epithelium. So simple columnar epithelium lines the endocervix, whereas the ectocervix is lined by stratified squamous epithelium, non-keratinized. So that is consistent with the vagina. The vagina is also non-keratinized stratified squamous epithelium. Okay, whereas the endocervix is consistent with the uterus. So the uterus is simple columnar epithelium. Just hold on a bit. All right, so those are the two parts of the cervix, ecto as well as endo. Cervix lined by two different types of epithelium. Okay. In addition to that, the cervix will also have the muscle layer, or we can call it the muscularis layer, which is consistent with the myometrium. Remember this, we say the whole uterus. After all, the cervix is part of the uterus, as endometrium, myometrium, and perimetrium. So within the cervical canal, we find that the mucosa of the cervical canal is lined, like I was saying, the endocervix is lined by simple columnar epithelium. And then we find special glands in the cervical canal. Okay, so the cervical canal measures about 2.5 centimeters length. It's quite a short canal. Okay, sorry for that. Okay. So I was saying 2.5 centimeters in length. Then we find that there are glands there. So there are glands in the cervical canal. So we call those as mucosal glands. Some books call them as Nabothian glands. Nabothian glands. So in the uterus, we discussed that part of the endometrium, known as the functional layer of the endometrium, sheds off during various stages of the menstrual cycle. But we find that the endometrium in the cervix does not shed off. It remains intact like the way it is, but rather the glands within the cervix undergo changes in response to the changes occurring in the uterus and in the ovaries. For example, during ovulation, these glands are widely dilated and secrete huge amounts of serous mucus secretion, and this mucus secretion becomes watery or slippery during ovulation. As you can see, at this stage, fertility is highest, And this is essential because it allows the sperm cells to pass through the cervical canal. Okay, but in other stages of the uterine cycle, for example, the luteal phase and during pregnancy, the secretion from this gland is thick and less slippery, like we can see here. So these stages, fertility is low. And if there's pregnancy, this mucus blocks or occludes the cervical canal. So sperm cells cannot swim through the cervical canal here because the secretion is thick. And this is essential during pregnancy because it prevents ascending infection from the reproductive system, that is the vagina, ascending through the cervix into the uterus where the fetus is developing from. So the mucus condenses there and then solidifies. That mucus is only lost when labor contraction begin. That's when the mucus will detach, and then you say the first water or the waters have been broken. Okay. So that is essential and worth noting. The function of the Nabathian glands in the cervix. They are essential for nourishment and migration of sperm cells from the vagina all the way to the cervix, and also prevent microorganisms and also blocks sperm cells from swimming through the cervix in phases when the woman is not fertile, like during pregnancy. So that's the same idea here that is being mentioned. Okay, so that's the structure now, the histological structure of the cervix. So this is the cervix of an adult. Okay, now I want us to observe that these are glands. These are cervical glands we are seeing there in the endometrium. That is the endometrium. That is the mucosa. Then here we have the myometrium, the smooth muscles we talked about in the uterus. So there we have a transition point where stratified squamous epithelium is transitioning with simple columnar epithelium. So SE is simple columnar epithelium, which is ending somewhere here, and then transitioning to stratified squamous epithelium. So this part is known as a ectocervix. This one here, lying in the vagina. This is a cervical orifice, external cervical orifice leading into the vagina. So vagina will be here at the bottom, the vaginal tube. Then up there is the internal cervical orifice leading into the uterine cavity. So you can see transitioning simple columnar epithelium, stratified squamous epithelium here. Now, I was mentioning something the time we're discussing on the uterus to say this transition changes position in someone who is a female before puberty. The point of transition from simple columnar epithelium to stratified squamous epithelium is somewhere here inside the vagina. Okay, but as this woman ages, the ectocervix is now covered with stratified squamous epithelium. So before puberty, this area, all this part will have simple columnar epithelium, like that. But in adults, we find that it is having stratified squamous epithelium. So the junction, this junction here, before puberty, it's somewhere here. So all this part will be simple columnar, then going up like that will be stratified. So in pre-puberty, it's somewhere here, the junction. This side will be stratified squamous, the fornices of the vagina. But in adults, the transition will be somewhere here, where up is simple columnar, then down all the way is stratified squamous epithelium. Okay, so what you are seeing there, those cavities are the Nabathian glands. Now, these glands are usually blocked. Okay, usually blocked, especially if there's some infection or some inflammation to these cells. Remember, stratified squamous epithelium is more like skin cell. Okay, so these cells continuously slough off. Okay, stratified squamous epithelium, the superficial layer is always detaching from the other layers. So when those cells detach, some of these cells can go and block the duct of these glands and form now what we call an Abothian cyst. So what you are seeing here, these are cysts where this gland is producing the mucus, but the mucus is not leaving the gland because the duct is blocked. That is called an Abothian cyst. So usually this type of cyst is non-cancerous, okay? It will swell and swell, but it's non-cancerous and requires no type of treatment. They will just resolve on their own. So even here, what you're seeing, there's an Abothian cyst when the glands become blocked. Even here, the glands are blocked, so they can't secrete their mucus. This is a common finding in most females, okay, because once in a while, there could be some infection in the vagina, and those will lead to blockage of the cervical glands, okay. So this is still showing us the ectocervix. Remember, ectocervix is part of the cervix that is in the vagina. Then endocervix is part of the cervix that is closer to the uterus. Okay, here. Ectocervix, that part here is ecto. Endocervix, that is the endocervix. Simple columnar, stratified squamous epithelium. Okay. So here, what we're seeing again, these are the same cervical glands. And we're saying once they are blocked, they become a Abothian cyst. Okay. Next, we'll look at the uterine tubes. So uterine tubes, or rather fallopian tubes, these are highly tortuous tubes that connect the body of the uterus all the way to the ovary. So there's ovarian ligament here. So the ovary is attached to the body of the uterus by the ligament. Then it's suspended like that. Then it is the function of the fallopian tubes to collect the ovulated ovum and transport it towards the uterus. So the ovum will come from the ovary, picked up by the uterine tubes, and then brought here, where if fertilization occurs somewhere along the uterine tube, the fetus will start growing in the uterus there. Okay, so let's look at the parts of the fallopian tube. So fallopian tube has fimbriae. We are starting from the distal. These are fimbriae, more like finger-like projections. So these extensions perform like fingers. So towards ovulation, the fimbriae come closer or migrate closer to the ovaries, the external surface of the ovaries, and begin to massage the ovary. So that in an event that the ovary ovulates, that ovum should not fall in the abdomen. It has to be picked by the fimbriae. So the fimbriae are closer here during ovulation and pick up the ovulated ovum. Next part is the infundibulum. So this is the infundibulum, the part that is closer to the fimbriae, the finger-like projections. Okay. Then after that, we have the ampulla. So the ampulla is the largest and most dilated part of the uterus, the uterine tube or the fallopian tube. And fertilization occurs in the ampulla here. And then, so think of sperm cells coming here from the vagina through the cervix, uterus, then they are coming there. Whereas the ovum is from the ovary through the fimbriae, enter the fallopian tubes, and then migrate there. So they will meet somewhere here. Okay. Then the fourth part is known as the isthmus. So the isthmus is a connection between the fallopian tube and the body of the uterus. Then there's a small part here known as the interstitial part, or simply the intramural here, that canal connecting the cavity of the uterus to the isthmus. Okay, so those are the parts of the fallopian tubes. It's shown here straight, but actually this is a highly tortuous tube. It's convoluted. It's a convoluted tube. Away from that, since it's a tube, we expect the same arrangement of layers. We have the inner layer, which is a mucosa. We're going to have the submucosa, then followed by the muscle layer and adventitia. So let's look at the fallopian tube histologically. So this is the same diagram. Fimbriae, you see how they are closer to the ovary. So this is towards ovulation. Okay, then we have infundibulum, that part, then followed by ampulla, isthmus, and the intramural or the interstitial part. Okay. Let's look at the epithelium found in the uterine tube or the fallopian tube. Okay, I have something here. So this is a fallopian tube. Okay, now, fallopian tube, just like the uterus, is lined by simple columnar epithelium. These are tau cells. But in addition, these cells have cilia. If you can see some hair-like structures there, these are cilia. So there is cilia in the fallopian tube. Apart from that, the mucosa of the fallopian tube is highly folded. So this is the lumen of the fallopian tube. That is the fallopian tube as well. So it's one tube, but if you cut it, most likely you cut it at different angles because it's a folded tube. So this is a cavity. So sperm cells will be passing through this. So the lumen is almost closed by these folds. Okay. So it's highly folded. You can see that the mucosa is supposed to be flat here so that we have a giant space there. But instead, mucosa climbs up like this, forms these extensive folds. Okay. So these are the folds that are being shown here, these folds. So if this is a lumen, so you have fold from all sides, fold from above, folds from the bottom, folds from the sides, and then eventually they meet in the center. So the lumen is almost closed. So this is a tunnel through which the sperm cells must swim through and actually identify the ovum. So for example, the ovum can be somewhere here, and then sperm cells are passing this side. So ovulation, fertilization may not take place. So that's why at any given time, during ejaculation, we need 1 million of cells to increase the chances of some cells finding where the ovum is hiding within the fallopian tube. Otherwise, it's nothing but simple columnar epithelium. Thereafter, we have some submucosa, and then we have muscles. Okay, so this is submucosa. We can see some blood vessels labeled BV. Those are blood vessels, which can be arteries and veins. Then we have some muscles, smooth muscles, inner circular, outer longitudinal. And those muscles undergo peristaltic movements, which propel the ovum, which has been ovulated from the ovary, from the fimbriae towards the uterine cavity. In addition to that, the cilia, that is part of this mucosa, helps to move the ovum towards the uterus. So two factors promote movement of the ovum, that is peristaltic movement of the muscles in the fallopian tube and the cilia in the mucosa itself. So that is a fallopian tube. Same thing shown here. Fallopian tube, that is a broad ligament of the uterus. Then we have some serosa, which is a supporting connective tissue. Then that is a muscle layer. Inner circular, outer longitudinal. Then that is mucosa, and those spaces, the white spaces, that is a lumen. Otherwise, it's supposed to be blank here, but because the mucosa is highly folded, that's why the lumen of the fallopian tube is almost closed. That's why if there's infection and inflammation of the fallopian tube, salpingitis, inflammation and infection of the fallopian tube, scar tissue forms here. There's healing of the fallopian tube by scar tissue formation, and that can block the fallopian tubes. Therefore, it becomes impossible or nearly impossible for the sperm cells to meet with the ovum and cause fertilization, and that may lead to infertility in a woman. So that's all about the fallopian tubes. So next we'll look at is the ovaries and the type of processes that occur there. Once more, if there are any questions concerning this discussion, you can still reach out to me and we can have some more discussion.